turn it over to her. Thank you again.
Absolutely. Thank you all so much for having me today. And again, thank you so much for all that you all do and in the communities these days. A lot is going on. But we certainly face challenges as African-American women. And first, just to let you know about myself, I'm an African-American woman, and I consider myself a health or patient advocate as well as a researcher. But my day job is actually in pharma and distribution and those kinds of things. And so I've been doing that for over 30 years, but please know I am not a healthcare professional. So I'm not trying to provide any kind of specific medical advice. These are just suggestions and just thoughts and considerations that I would like you to consider. So next. Okay, so the objectives that I'd like to complete today are to tell you my research, a little bit about it as it relates to what we'll be discussing, and also my personal story, my family story, because as Nia said, I think that kind of shapes as to why I'm interested in hearing and listening to and really embracing women's voices, particularly Black women's voices, or any disenfranchised or all voices, but mostly Black women's voices. I'd like to discuss the historical and present day challenges that we face as it relates to healthcare for Black women, and a little bit about the social determinants of health and how they differ for all of us depending on our station and our level of privilege. And then also, finally, some suggested action steps, and then we can do Q&A and go from there. Next. So first, I'd like to begin with the past, because I know there's a lot of voices out there, people that say, well, why are we talking about the past? We're, post-racial society, we're over it, and obviously we're not. But the point of it is that the past actually still continues to inform our current situation, and actually still, sadly, the negative parts of it actually impact our present. So to begin with, discussing like the lingering power of the past. So we have James Marion Sims. I know New Yorkers probably are more familiar with him perhaps, and maybe all of us are, but he was considered to be the father of gynecology. And I'll go into that. Henrietta Lacks, a woman who from her cells actually provided a lot of pharmaceutical research, or cells from her research that were immortalized, that essentially were used for research, and unfortunately her family was never compensated. And of course the Tuskegee experiment, the 600 men that were in that study and that continue to be a part of the study, but many of whom were not treated, and actually their families and others were witness to their demise, not getting treatment, and then sadly eugenics and sterilizations. That's the sad commentary as it relates certainly to the devaluation of life. Not only Black lives, but many minorities and those that were not deemed worthy, or just needing to live because they were not considered of value. And unfortunately, my research as well has shown that what has happened is that these things continue to be an influence. It influences, or it influenced our parents, it influenced, even though sometimes in subtle ways, it influenced our grandparents and great-grandparents, and the memories that they had as far as their experience in the healthcare systems, or just, what they heard tell of, and how it subtly, continued down to our generation. And so unfortunately, even though many of these things have passed, they still remain a part of our current present, or our present. And then we talk about healthcare professionals, when we talk about our doctors, nurses, and how, they've been influenced, in terms of just preconceived notions that they have, and just examples of those. But I'll go to the next slide. Okay, and this slide essentially depicts just some of the sentiments that were present prominently in the early 1900s, as far as some people are born to be a burden on the rest. Again, devaluating life and the function of that being, just really a lot of sterilizations. And sadly, not only was this supported by many state governments, I think the number was 31, unfortunately, I mean, this was legal, where essentially, people were sterilized many times, obviously, or not obviously, not knowing that that was occurring or that that was going to happen. And even when we press this forward or push this forward to present day, when we talk about Black women having a higher incidence of fibroids and going, to their healthcare professionals and it being recommended, that they have surgery, that they have hysterectomies and such. And so kind of like the subtle things that are done or direct things that are done to limit life. And so next slide. This slide essentially is a depiction of James Marion Sims, and in the background, it's not a very clear picture, but essentially the woman who in slavery many of those women were used in experimentation, and many of his ways of surgery, ways of conducting surgery, essentially were at the expense of these women. And essentially during that time, anesthesia was not used. Some say that in that time, anesthesia was not commonly used, but certainly the narrative suggesting that Black people don't feel pain in the same way of people of other races or white women. That assertion is out there. And unfortunately, when you look at, the pain meds being used, opioid usage, and that's a whole nother thing, it's lower because we're not offered or have not been offered pain meds as often, perhaps, as needed because of that perception that some healthcare professionals have held over time. So next. And here we have Henrietta Lacks. Here's the woman whose cells were used and essentially immortalized, where and her family actually did not, or were not made aware of the usage of her cells into the mid-1970s, when they were asked for blood samples. But the point of it is that at that time, she was born in 1901, and I think she died in 1951. But the point of it was that, at that time, it was not, you did not have to get consent for usage of cells and, treatment and that kind of thing. But the point of it is, though, is that to date, I mean, while there have been buildings, named after her, markers, and, there's a book, and I mean, there's tons of things that have been done, but I believe to date, her family has received little compensation. There have been some foundation support or scholarship support and that kind of thing, but direct financial support or payment for her cells being used, that's not been done. Now, of course, there are updates, but last I heard that's not been done. And interestingly, I'm actually in Maryland, and Hopkins is currently, with everything that's gone on, they're actually in the process of looking at social justice issues in health at Hopkins, because obviously, Hopkins is a huge academic center, but in the community, you have many Black people that feel, today, that Hopkins is not a place that they'd feel comfortable going because of the legacy of mistrust and fear that has been, instilled with those within that community. So again, that legacy of distrust and just being treated unfairly continues today. Next. And here we have a gentleman, one of the participants in the Tuskegee experiment. He was actually, this is a picture of him going on, I think, series, and then later to the White House at that time to be offered an apology by President Clinton, acknowledging, the wrongdoing of those 600 men who, while there was treatment available for syphilis, many of them were not offered treatment, and again had to suffer, going through that disease along with their families, not to mention the women that they infected. And I mean, it's just, and then when you look at how people feel, continued, distrust, you know, it just continues, even when you look at while clinical trial participation is very low across the country, it is especially low in the African American community. The reasons for that are varied, but the point of it is that here's an example that people still look to supporting why they don't want to participate in a clinical trial. So next. So Evelyn Hammonds, who was a part of the 1619 project, which I can't begin to say how much I appreciate that work of essays that was presented by the New York Times. But what she says is that there's never been a period in American history, I can't read that because I can't say, but you can see that essentially the disparity is built into everything, you know, as far as healthcare. So where we are today, essentially we have telehealth and, you know, with the pandemic, and, you know, that's going to continue. And the good, the bad, I mean, the good news is that I feel like everyone has a cell phone. And so you can essentially, you know, if your healthcare provider has that, you know, you can use that to get, you know, some resolution or some treatment or some advice for whatever, you know, is going on health-wise. The Affordable Care Act, I mean, it looks as though it's going to continue unscathed and hopefully improve. I mean, there's still time left, so we'll see, hopefully. When we look at what's available for people, their clinics, urban hospitals, rural hospitals, unfortunately, many of the rural hospitals with the pandemic and funding and such are actually probably going to close, some of them, or, you know, a number of them. The next, you know, in spite of the ACA, emergency department still continues to be a primary physician for many people. And so it's good that people are going, but on the other hand, it's a better option would be to have your own physician, you know, with whom you have a high level of transparency and comfort with. And then when we talk about, as you know, moving into more and more drug discovery, you know, specialized medicines are continuing to come out and be approved by the FDA. And trials obviously have to be done. But again, as I mentioned, the research is not inclusive. And Black women continue to have worse health outcomes across the board. And then we have the stereotypes of race-based medicine, the things that are done not based on science, but rather based on assumptions that were made. You know, for example, creatinine levels, you know, suggesting that it should be different for a Black person as opposed to a white person, because it's thought that we have higher levels of muscle mass. Not the science, but rather because of the color. Somebody looking at that external, you know, in terms of the skin color or what you declare yourself to be as being the reason, you know, for making a medical decision. And then the continued, as I mentioned, you know, as far as the legacy of distrust. So as across the board, people of color, particularly women, receive less care, worse care, lower rates of health coverage, the communication barriers, as well as the racial stereotyping or bias. Next. So again, here are some stats, and I can't totally see that slide, so I can just go over some of it in terms of the health coverage. 2017, 10.6% uninsured, mental health, African-American women dying by suicide, leading cause of death, heart disease, cancer, accidents, and across the board, African-American women or African-Americans have the highest mortality rates of all the cancers. 80% of African-American women are overweight or obese versus 64% white women. African-American women rate of asthma and hypertension. And, you know, this was Cigna Health life insurance, but it's pretty similar to CDC data and such, but that was just what I shared as far as some of the stats we're against. Next. And then when we look at, you know, healthcare professionals and the demographics, this is important because the data across the board, you know, consistent with the research that I did as well, it suggested that patient-provider, racial and gender, that there's concordance to better communication, trust, and better health decisions. So essentially, if I'm Black and a woman, then I feel most comfortable and I feel best about care with someone who's Black and a female. Similarly, if I'm a Black woman, I feel more comfortable with a woman, or more comfortable with a Black, healthcare professional. But when you look at these numbers, 4.5% of physicians are African American. Small numbers of medical graduates, being Black, and currently 50.7% of the medical school enrollees are women. That's the good news. But then 4% of the active physicians are Black, 2% Black women. Nurse practitioners, which certainly have a high level of prominence as far as their ability to prescribe and to provide, certainly key information that's needed. And actually, honestly, I have had very good experience with many nurse practitioners. When you look at the demographic, that's information that's a little better, but the point of it is it's certainly still lacking. So, next. So when we look at the women participating again in clinical trials, and this is key, especially when we talk about the coronavirus and people wanting to not contribute, but to be a part of the trials, we'll just see how that goes. But the point of it is that that's something that's problematic. Further, when you talk about clinical trials, there are a number of people that may or may not be able to be, or not eligible to be in clinical trials because of comorbid conditions. That's a whole nother thing, but the point of it is that clinical trial design perhaps needs to change and be modified so that more people can be included as well. But as an example, like another specific challenge to Black women would be the high maternal mortality rate in childbirth, as well as the year following. And I cite Serena Williams as a perfect example because obviously socioeconomic issue is not hers. And I mean, I'm sure that she could get any physician or healthcare professional that she would want in order to help her, during pregnancy or any kind of medical issue. But the point of it is that was something that, she almost died from the standpoint of, perhaps, I don't know all of the ins and outs of it, but what she does say is that what she wonders is whether she was taken seriously, if her voice was being heard. And then next, high rate of obesity. And then religiosity and health navigation. For Black women and others, this is a huge issue. And I found that to be true as well in my research, in that, when I say religiosity, is that, from the pulpits or, the religious leader, perhaps they may not embrace the role of healthcare professionals or westernized medicine. And that's not to say that, westernized medicine is the only way to go and that there can't be some other things to consider. But the point of it is that, that narrative out there that, well, God's going to heal you. You don't need to do anything, just pray. And but I definitely believe in the power of prayer. I believe that God can heal, but I also believe that God provides us with healthcare professionals and others to help us in that healing process. And then the superwoman syndrome. And what that is meaning is that how often is that we have so many things going on that we don't take the time to care for ourselves, to say, well, you know what, I can't do that, or I need to take care of myself. I need to make sure I do screening tests. I need to do these things, not putting them off, but pushing it forward and taking care of ourselves so that we can be there for others as well as our friends and our family, but not recognizing that we're important too. And then stress. That's a whole nother thing. And the stress of just being a Black woman, or, family issues, whatever. But the point of it is that that's a big challenge that Black women, as well as many women and others, face as well. And then finally, health coverage and access. The slide prior that insured was about 10.6, 10.7, but, insurance coverage varies. Some things are covered. Sometimes you have a high deductible. Different places don't necessarily take your insurance. So, there are a lot of challenges surrounding that, as far as how to both navigate the system, maximize it, and get all that you can get. So just things to consider as far as that's concerned as well. Next. So let's talk about the social determinants of health. And I think this is a key slide because it's varied. And the thing that's interesting as I thought more about this is that it's different for everybody, you know, depending on your level of privilege, depending on what's important to you, the things that you embrace, the things that you're able to embrace, the things that you're able to change, it varies. So when you talk about your education, when you're talking about your neighborhood, your physical environment, is it safe? Can you walk? Can you run? Can you, I mean, it's a question mark and it's different for everybody. And your economic stability, you know, does that provide, or do you have stress because of that, you know, and just how that impacts your health, the healthcare system, you know, are you in a rural area, urban area? I mean, and what's available to you? Does it take your insurance? Those are all things that you would need to consider and be mindful of. And the community and social context. Who are you around? You know, are you around toxic people? You know, people that are stressful? You know, what's in your community? What's in your, you know, what's your situation? What's your station? And then finally, food. You know, what are you eating? What is available to you? Are you in a food desert? I mean, it's varied. And what food choices are you making? You know, those are all things that are considerations. Some of these things we clearly have control over, more control or less control depending on your station. But the point of it is, and the thing that I would really like to impart is the importance of us taking some ownership and really looking at these things and saying, well, what is it that I can do? Because so many of the things like the ACA, like, you know, our healthcare insurance, what we can afford, what our job offers or not, all those, so many of those things we may not be able to totally control. So really, really embracing the things and taking ownership of the things that we can control. Next. So again, one of the major action steps is to using your agency and recognizing that you have it. And so, for example, specifically, when you're choosing a healthcare professional, interview them, ask them questions. I mean, don't feel like you necessarily have to settle for the person that you have. If you're not happy with them, if they're not listening to you, if they're rushing you, choose another one. Another thing that I'm really big on is wearing a bracelet or a necklace or some kind of identification noting if you have a healthcare or if you have a health condition that someone would need to know about in an emergency. Another, consider participating in clinical trials. Diversified data is needed. I can say from a personal experience, my dad, he actually died from melanoma. He was very fair. I mention that because there's that myth out there that, you know, brown people don't get melanoma, but he was fair. But the point of it is that it's in my family. And so be mindful of sunscreen and such like that. But the point that I'm making with that is that he actually passed away during a time when there were clinical trials for drugs that are now approved for treating melanoma. So the point I'm making, and I remember him talking to me just kind of like very discreetly that he even had skin cancer or that, you know, melanoma, and, you know, it kind of like came out, you know, in a random conversation as to why he couldn't attend something. And so that even brings me to the whole issue of just the whole silence, you know, where people don't want to say what's wrong or what their history is, you know, as far as health history. But anyway, the point that I'm making is that had he considered participating in a trial, he may still be living, you know. Another, bring a friend or an advocate during your doctor's visits or healthcare professional visits. I mean, perhaps, you know, during this pandemic where a number of the offices are saying, look, you just come, your family member needs to stay in the car, perhaps have that family member on the phone, you know, so that they can witness what's being said, so that they can share or have some pertinent information, provide that as well. But it's always good to have somebody there, if they can be, to advocate for you, to be a support. Journal any symptoms that you're experiencing, even if you think that they don't even relate or that they're random or this has happened for a long time. When drug choices are being made or when treatment is necessary, it's important that the healthcare professional know, well, what happened? When did it happen? What exactly were the symptoms? And, the vague, kind of, it's probably nothing. Write it down. Have a journal of what's going on, especially if you start a new medication or just if you're going through any kind of health challenge, have a journal. And then be an informed patient. Come to the healthcare professional with questions. I mean, I can't, and what I do day in and day out is talk to doctors and nurses. And so often, not all, but I mean, some of them tend not to want to engage, and, they just want to tell, what you're going to do, what they think you should do. And some, don't get me wrong, are, very conversational and such, but they have a limited amount of time because they have to see that next patient. So come prepared with questions, pointed questions. If they want to recommend a medication, say, well, why are you choosing that one? What about another one? So just things to consider. And then another, as I mentioned, use your pharmacist, as far as medication, use your pharmacist as a resource. As far as compliance, don't just take compliance and just kind of manipulate it. If you're being told, or if you're being directed to take a drug a certain way, then do that. And if you can or don't feel comfortable, or if you have side effects, you need to let the healthcare professional know. And then further, another reason for the journaling is because doses can be adjusted. Maybe you're taking 2 pills, maybe they want to lower to 1 or just lower the dose. And then diet. Again, as I mentioned, when we look at the social determinants of health, there are things that we have control over. I mean, there are things that, we should not eat. It's just not a good idea. We just need to leave it alone or lessen it, or just moderation. And then also just the importance of knowing that when you go to your healthcare professional and, you're looking at your budget and saying, well, I don't know if I can really afford that medicine. The reality of it is that most or many of the pharmaceutical companies actually have programs that can provide you with support. But you have to ask sometimes. Not always will the health professional tell you about it. And then also sometimes they have samples very often, even for, some of the more designer or specialized medications, pharma does provide samples upon request. Next. So key takeaway, knowing your numbers. As mentioned in a prior slide, one of the biggest, or actually I think the biggest cause of death for African Americans is heart disease. And I mean, my own personal story is that I had an older sister, and close to now, like 10 years ago, she passed away sadly on Thanksgiving Day. She was at her home preparing dinner, and everybody was all hyped to having dinner at her house. And unfortunately, she passed away of a heart attack. Why was that? I mean, a varied number. I mean, some decisions that she made, but one of the decisions that I'm convinced, as far as how that happened or why that happened, was that she didn't have very good health care. She was unfortunately going to a community center, and then further, she was making some lifestyle decisions, and probably, she wasn't getting the counseling necessary, to know how best to take her medicine and navigate that whole thing. But I will say that it's imperative that you know your numbers. Know what your blood pressure is. Know what your cholesterol level is. I mean, there are just some basic things. If you're diabetic, know your hemoglobin A1C. I mean, those are A1C. Those are important things for you to know and be aware of and to monitor. And again, choose your healthcare professional. Choose a healthcare professional who listens to you and respects your voice. You have to do your part. Stay up to date on your screening tests, and of course, that speaks to your age as well as heredity. Knowing your history, knowing your mother's history, knowing your grandmother's history, asking. And unfortunately, like I said, group, I think very often there's a narrative out there, well, don't speak it, I'm not sure what she had, but she just died. And the thing is, there is a story, and there are reasons, but we don't always know them. We don't always ask, and we're not always told. And then again, bet on yourself. I mean, we have, in this country, many resources available to us, but at the end of the day, we have to take responsibility for ourselves and bet on you. ACA, other healthcare professionals, yes, get the best one you can, the whole 9 yards, but bet on yourself. Next. Some of the questions that you can ask yourself, as far as the healthcare professional that you've chosen. Why did I choose them? Did I choose that healthcare professional because I can just basically tell them what I want? Yeah, give me the antibiotic. No, not that one. No, as opposed to really listening and hearing and being open to what they're going to suggest. I mean, how many times, and I don't know if this is true for, everybody, but I know for me, how many times have I gone to the doctor and I've been overweight and the doctor didn't even bother to mention it to me? I mean, I'm not saying why, but the point of it is that did she assume, that it's okay for a Black woman to be a little heavy? I'm not saying she did or didn't, but the point of it is that, we need to have healthcare professionals who are going to challenge us to be the best that we can be, to be the most healthy that we can be. Is he or she culturally sensitive? Do I feel comfortable being honest and transparent with the person? Again, do they or does he or she challenge me to live my best life, to be healthy? And as I said, or does she or he just basically, allow me to tell them what I want and that's what's going to happen? So while we have agency, we still, it's important to listen to, the expert or to somebody that certainly knows more about something than we may. Next. And then one other thing, and I thought I would have more, but I mean, as I mentioned in the very beginning of the talk, is that I am fascinated and just taken back by women's voices. And I think, and these are two examples of, two projects that are out there or have been out there, that are essentially listening and seeking women's voices, listening to their stories. And stories are so important as we navigate this health space and figuring out what's best and how everyone can win and be most healthy. So the point of it is, please use your voice, embrace these projects, and I'm sure there are more out there, and I'll continue to build my list. There are more, but those are two that I noted. Next. And that's it. I appreciate your time. My goal in this is just to help all of us see the level of agency that we wield, that we can truly take control to a large degree of our health and certainly be active, use your voice and just some of the challenge that we face and how we can press forward together to be more healthy as Black women. So that's it. Thank you. And if anyone has questions, I'm happy to address them, or if you would like to send them at a later time, that's fine as well. I have some additional references as well that I did not include. And if someone's interested, I can forward that too. So thank you.
Thank you. We really appreciate you taking the time to educate us on these topics. I had a question. Well, I have more than one, but I'll start with the one. As an African-American woman, I know there are some kind of genetic or kind of predispositions we have, right? And I want to know how we can be a little less sensitive when it comes to culture, like tying that to cultural, things that, as a Black woman, I'm typically, going to engage in. And that includes fried foods, that includes fried chicken, that includes some of the things that I've come to grow up in, like in terms of my diet, in terms of, exercise, right? In terms of, I love Pepsi. It was one of those things I had to slowly kind of, stop drinking and limiting the sugar in my life. How do we kind of become less sensitive and being challenged about some of the things that may not be healthy aspects of the culture in terms of, things that we may have grown up, enjoying and engaging in? How do we kind of make that transition to a healthier lifestyle?
Wow, I wish I knew. I guess the one thing I will say is gradually, in moderation. I mean, as I grow older, I'm finding that I have to, you know, really, really embrace those things, and things that I used to like and love, you kind of just change your tastes. I mean, and, you know, moderation. I mean, for myself, I can't tell you the last time that I fried chicken. It doesn't mean that when I have fried chicken from Popeyes, but I just try to drive by. But the point I'm making is that, you know, there are things that we just have to change, because it truly is killing us in so many ways. And I mean, you know, that whole thing of clinical trials, I mean, I can't tell you the number of times that I've been to cancer centers for work, and you see, you know, all of these women, non-Black, who, yeah, I had, you know, stage 3 lung cancer, and I tried this drug and it's working great. So I mean, that's not even an exaggeration. But the point I'm making is that if we're overweight, or if we have hypertension, or if we uncontrolled hypertension, we're not going to be considered for those trials. I'm not saying that's right or wrong, but the point of it is that pharmaceutical companies are not going to take the risk. They're not going to take the risk because they don't want you dying, and then it essentially being attributed to that drug. And that's just the sad reality. And I mean, that's kind of that's pushing the envelope. But the point of it is that we have to do better. Do we want to live, you know, do we want to live our best life? I mean, if we're overweight, I mean, I can use myself as an example, like my grandson, Emerson, you know, and Avery. I mean, I want to be around. I mean, and even something is like carrying him. I mean, because, you know, he's smaller. I mean, I do push-ups. I mean, I'm excited. I'll show you my arms. But anyway, the point I'm making is that I do 20 push-ups at least every day, because I want to be able to carry him. I don't want to be that meanie that, oh no, you can't carry me. No, I want to hold him. I want to carry him. And so it's really more of my point is that, yeah, there are tons of stuff we can't do. When we talk about what we put in our mouth, we just have to try to change the habit. And I mean, on the other hand, a weakness of mine, I think it's been 5 days since I've had potato chips. I'm very proud of that. But I say that to say everybody's got their thing, you know, but moderation and changing. Like when you cook collards and with, you know, salt pork or whatever, you know, use chicken broth. It might taste a little different, you know, or just don't cook with salt. I know, you know, it doesn't taste as good, but your taste will change, you know. So it's a great question, and I don't have the easy answer, but the point of it is that the answer is for us to make the changes, in my opinion.
Thank you so much. Do we have any other questions?
Yeah, I have a quick question. So I did come in a little late, so I apologize if this question was answered. But as a not person of color, but I am a healthcare worker, how would you suggest that I open the dialogue with my patients about cultural differences?
Honestly, I think the biggest thing is if you have time, and I know that so often, you know, healthcare professionals have a limited amount of time with each patient because you have tons coming in. But I would say, listen, to ask questions. Well, how do you feel? Well, how did you feel about that? What are you doing? Just to kind of get a sense of what their lifestyle is doing. What is their life like? And so, I mean, I think that in asking them questions as far as increasing cultural sensitivity is really more of a matter of looking at, you know, those social determinants of health. And you kind of see, well, these are things that impact all of us to different degrees, and really kind of have questions related to that, you know, so that you can kind of tease out where they fall out on those different things in terms of, do they have social challenges? Do they have economic challenges? Do they have, you know, issues as far as seeing a physician or healthcare professional that they're happy with? So the point that I'm making is that it's being armed in humility, armed in just a sense of, help me understand what your situation is, and listening carefully, and then based on that, and then pushing forward.
So
you know, one of the things that my research sorry.
No, that's okay. You were breaking up. So what I'm hearing is, and I teach future healthcare professionals. So it's important because I do try and teach cultural humility. And when we do patient interviews and that kind of thing, they're always asking, how do I ask this question without sounding like I'm racist or I'm building this barrier? So if they just ask the questions open-ended in general, is that what I'm hearing? As opposed to saying, as a Black woman, blah, blah, blah.
Right.
You know,
Exactly.
just like, well, what's your diet like? So, and that's okay to realize that there is that difference. It's
Absolutely.
because so many people, I hate to say it, are, especially now, kind of tiptoeing around. Like, we don't want to draw that line, but the line is there. We just have to figure out a way to blur it, you know, to kind of jump over it. Okay, I just wanted to make sure that I was on the right track. In fact, you know, and as far as trying to just include everybody by asking open-ended questions. And as far as not having time, that's our job. Our job is to make the time to ask that question.
I appreciate that. I mean, I that's great. I mean, and I think to your point, you know, that open-ended piece and being, you know, just letting them go to some degree is just, that's really the answer. But having the courage and the conviction to do it. You know, it's one of those things. What are the choices? If you make the choice of, oh, I don't want to broach that topic because I don't want to offend. Okay, so they're going to walk away doing the same thing they always did, not acknowledging that I need to make a change. So I trust me, I understand, and I deal with that in, you know, just different situations where people aren't comfortable about, you know, pushing forward and taking the chance. It's kind of like, what's the worst that could happen? I mean, I get it. They could say, well, I don't want to go to her anymore, she's racist. But the point is that asking a question, take the chance.
Thank you.
Well, again, I just wanted to thank Dr. Corinne Toomer for her time. There are not any more questions. You can always, if you have something that comes up later, you can reach out to us via info@kusudi.org, and I'll be happy to forward the questions over to our speaker. We thank you guys all for participating on today's lecture series. Next weekend, we have Coffee and Cardio on Saturday by Dr. Ito, who's actually joining us. She is a professor at Marist University, Marist College, and also just a wonderful person in and out. And so we're happy to have her on Saturday. And then on Sunday, I will be sharing about common pediatric disorders. So if you are free and want to join us, we're happy to have you. Again, we thank you for your time. Thank you, Dr. Toomer, and everyone. Enjoy the rest of your Sunday afternoon. Have a great one.
Thank you.